Whether you're thinking of having a baby, or you're on a journey of being new parents, or you're just curious about what happens with pregnancy, during pregnancy, let me tell you that you're in the right place. Welcome to All Around Health Talk with your girl, Dr. Onyinye. Remember, this is a channel where our health is our priority. Now, before we go right into our topic, make sure to hit the subscribe button. You want to be notified for every time I post an educating and enlightening video. So go ahead and hit the subscribe button and also put on your notifications so that you will be notified. Now, today we're going to be diving into a topic that is very amazing yet very mysterious. We're going to be diving into the world of pregnancy. Now, we're going to talk about pregnancy because pregnancy is a whole world on its own. We're going to be talking about it in 4 parts. We're going to be talking about before pregnancy. That's how do you prepare to get pregnant? You don't just wake up and get pregnant. You need to prepare for it, right? We're going to be talking about before pregnancy. We're going to be talking about during pregnancy. That's how do you take care of yourself and your growing baby during the 40 weeks that child will be inside you. Then we're going to talk about after pregnancy. Yes, we need to know what to expect after the baby comes out. Many people feel like after the baby comes out, everything goes back to normal. Your body's going to snap back to normal. Not necessarily the case. You need to know what happens after pregnancy, what to expect. And then the 4th part of this video will be about debunking every myth that you know about pregnancy. Now, let's get into today's topic. We're going to be dealing with before pregnancy. Now, you and I know that pregnancy is a marathon. It is not a sprint. It is a journey of 40 weeks where an entire human being is growing and developing inside a woman. We really need to have all the information. If you're a woman and a man, and as a couple, you're ready to get pregnant, this is what you and your husband must know and do before pregnancy. Now, the moment you and your husband decide that we want to get pregnant, the first thing you need to do, if you don't already have a gynecologist, the first thing you need to do is get a gynecologist. A gynecologist is an expert in female reproductive health. They're the people that will guide you through the process of pregnancy. There's a lot that happens in pregnancy, and yeah, you probably have your mother-in-law that you can rely on, but there are certain scientific things that you really need to take into consideration. So number 1, get yourself a gynecologist. Now, number 2, we're going to talk about folic acid. Folic acid is a version of vitamin B9, which is very essential for cell production and development. So, folic acid is going to play a very important role in the development of the cells, the tissues, and the organs of your baby. You want to make sure that you have enough folic acid, right, in your body, because your body does not necessarily produce enough. So you get it from food and you get it from medication. That's why you are going to have to take folic acid. Now, you're going to have to take 400 micrograms or 5 milligrams of folic acid. You don't wait until you get pregnant to start taking folic acid. That's why we're talking about before pregnancy. You have to start taking folic acid as a woman 3 months before you intend to get pregnant, all the way to the first 12 weeks of your pregnancy. Okay. Now, folic acid is going to help specifically with the development of your child's nervous system and the brain, to avoid problems that have to do with the nervous system. So folic acid is your guy for that. Now, if for some reason you get pregnant without preparing for it, the moment you find out you're pregnant, you need to start folic acid. And that's why number 1 is getting your gynecologist, because your gynecologist will give you your prescription for folic acid. You're going to take folic acid all the way to 12 weeks of pregnancy, because the first 12 weeks of pregnancy is when organogenesis happens. That's when the organs of your baby begins to form. So it's a very delicate time in pregnancy, and that's where you need your folic acid to work. Studies have shown that folic acid also helps men with spermatogenesis and the quality of their sperm. So it helps them improve their sperm quality and also helps with the production of sperm. So your gynecologist might recommend that your husband also takes folic acid with you once a day, just like you, for 3 months before you get pregnant. After you get pregnant, your husband doesn't need to take any more folic acid. You, however, have to continue with folic acid till 12 weeks of pregnancy. That's number 2. Number 3, we need to quit smoking and drinking. All right, if you're someone who smokes and now you're preparing to get pregnant, you need to stop smoking. Smoking and drinking can cause malformation in your baby. So you want to quit smoking before pregnancy. Once you get pregnant, you have to quit drinking. Smoking, drinking, pregnancy, they do not work together. So quit both. Next is your weight. Yes, your body weight. You need to maintain a healthy body weight for you to get pregnant. So before getting pregnant, you need to make sure that diet is right, exercise are right, and that you're weighing the normal weight that you should weigh based on your height. Right? That means your body mass index should be within the normal range. You shouldn't be overweight or obese. Because during pregnancy, because an entire human being is growing inside you, you're going to add weight, which tends to be difficult to lose after pregnancy. That's one. Number 2 is that being overweight or being obese before pregnancy can make it difficult for you to get pregnant and can actually increase your chances of complications during pregnancy. So you want to make sure that your weight is normal before pregnancy. Another thing are vaccines. You need to make sure that your vaccines are up to date. Specific vaccines that you should have up to date before getting pregnant are COVID-19 vaccine, measles, mumps, and rubella vaccines, because these vaccines will prepare your immune system to defend you and your baby against any infection that might come up while you're pregnant. All right. Now, next on the list are medications. If you're taking any medication for whatever reason, you want to talk to your gynecologist about that to see if the medication is a medication that affects your pregnancy negatively or your chances of getting pregnant negatively or positively. If it doesn't impact you in any negative way, then you can continue taking those medications. If not, then another decision will have to be made. Next is genotype. You need to know your genotype, especially for blood diseases such as sickle cell anemia and thalassemia. This is very common in the African continent. So you want to know if you or your husband have sickle cell or are carriers for sickle cell. If you have sickle cell, your genotype will be SS. But if you're a carrier, it will be AS. Now, why do you need to know? If you are a carrier, you have AS, and your husband is a carrier, he has AS. It means that at least one of your child is going to end up having sickle cell anemia, which, as we know, is a very, very delicate disease. You want to know all of that so that the right decisions can be made with regards to your genotype. Next on the list are chronic diseases. If you suffer from chronic diseases such as epilepsy, thyroid issues, diabetes, high blood pressure, you want to talk to your gynecologist about these conditions so that we make sure that your conditions are under control. If your condition, for example, diabetes and high blood pressure, are out of control, they're not being controlled, they can make it difficult for you to get pregnant, or even if you get pregnant, they can cause complications during pregnancy. So you need to discuss chronic diseases with your gynecologist. And last but not the least are tests that have to be done. In one of our videos, we talked about sperm analysis. So sperm analysis will have to be done on your husband to make sure that he has the right sperm production and quality that will fertilize your egg and give rise to a baby. And for you too, tests will have to be done on you. Blood tests will be done, urine tests will be done. We want to know if you have any diseases that have gone undetected, anemia, infections, hormonal diseases, glucose level, thyroid hormone levels, all of that one will be tested. And then obviously an ultrasound will be done to see how your uterus is looking, how your ovaries are doing, because we don't want to miss out on any cyst or fibroid that might be growing inside you. Because remember, if you have fibroids, for example, it could make it very difficult for you to get pregnant. It could cause miscarriages if you get pregnant, or it could cause other complications during pregnancy. So the idea of doing an ultrasound is to make sure that you are fit and that your organs are ready. And if anything comes up during the ultrasound, they'll be treated first before you start trying to get pregnant. So this test will be done on you and tests will be done on your husband just to make sure that everything is copacetic. Now, as a recap, what must you do before you start trying to get pregnant? At least 3 months before starting to try for pregnancy, you need to start taking folic acid, but you need to get your gynecologist first. Take folic acid, avoid smoking and drinking, maintain a healthy weight, get all your vaccines up to date, talk medications and chronic diseases with your doctor. Make sure you know your genotype and obviously the tests that need to be done. Now, I hope that this video has been very educative. Please go ahead and share it with other people. There might be somebody who is who has just gotten pregnant or thinking of getting pregnant or trying to get pregnant. This video will be very helpful to them. So please, I hope you're willing to share this video. Also, if you like this video, go ahead and give me a thumbs up. If you have a question or a comment, leave it in the comment section and I'll get right back to you. Last but definitely not the least, you need to subscribe to this channel so you don't miss out on these amazing and educative videos. So put on your notifications so you get notified for every time I post a video. Thank you, and I'll see you in our next session of our pregnancy topic. Bye.